Well, good day, everyone. This is Dr. Jamie Kirkpatrick, and I'm here with my colleague, Caroline Redmon, who's a licensed marriage and family therapist. And we are going to talk about borderline personality disorder today. We, realize that we've actually seen an increase in this over the past few years. And so we think it's important to bring some information to you and hopefully help you heal. So I would like to, well, actually, I wanted to say that, borderline personality disorder is a pervasive disorder. So it starts in childhood, but, as an adult, if you continue to have the symptoms of that, it's pervasive. It just keeps going and it's all encompassing in your life. And people just really struggle to heal from it and to grow and change and make good relationships. So really, borderline personality disorder really impacts your relationships with everybody, but especially those closest to you. Caroline, why don't you talk about a couple of issues like boundaries and derealization and idealization?
Okay, well, I think, as Jamie said, that borderline personality disorder, people who suffer from that, it kind of starts with childhood. And it appears that one of the main issues is feeling of abandonment, where young children don't feel supported. And that affects how they perceive the world. It also affects how they perceive themselves. And with such a low self-image, their perception of the world is that if my significant caretakers reject me, well, then the rest of the world's probably going to reject me as well. And that plays heavy on how children grow up and turn into adults.
Yeah, and
And
what we do, right, is that when we have those borderline traits, we're so afraid of abandonment and rejection that we make frantic efforts to avoid it. And part of that is that we will reject. We'll reject the other person so that we don't have to feel that pain of rejection from them. Yeah.
that's very, very true. And when working with people with with these issues, it it's so painful for them
Hmm.
that they will focus on external things that upset them versus looking inward. Like
Absolutely.
can I give an example?
Oh, absolutely.
The example is I knew of this person who grew up in a family where she was not very much supported, and her focus was on her appearance and how she looked and how she perceived other people were going to perceive her appearance. And she struggles so much with that to face the feelings of feeling rejected and less than, she will focus more on how she looks or how she functions versus getting into the internal feelings of loss and abandonment. It is so painful
People.
that
Yes.
it's like that's a territory she just has trouble
Yeah.
entering into.
Right. And so it's situations like that where people have an idealization of someone in a relationship, and they will show them to be, or what's the word, make them out to be this person that they really admire, right? But then something happens and they devalue them. They get angry and irrational and impulsive, and so then they breach boundaries. They don't have good boundary issues, right? And so because they can't look at that pain, those emotional issues that are underneath, they essentially have a trauma response, in communication with others. And so they will just then attack in order to defend themselves, right? So they have those impulsive,
Exactly.
rational behaviors, which sometimes is substance abuse, self-injury, even suicidal behaviors, right? And one of the things that really stands out to me is those chronic feelings of emptiness they're just so profound. It's almost just an impending doom sometimes. So,
Yes, that's an interesting point about the emptiness. Um, because they're looking to fulfill themselves with externals.
right.
And anybody, just whether you have borderline personality or not, when we seek to fulfill ourselves or to feel okay about ourselves, looking for approval or like, am I doing good at my job, or do I look pretty, or do I have a lot of material things? There's always that empty pit inside that never ever gets filled.
Yeah.
And I also wanted to remark also about and this about borderlines as well as people who are not borderline, this issue of competitiveness, of never feeling good enough.
Right.
So if I'm not as good looking enough or I'm not as competent enough, I'm no good. I'm not meeting the mark.
Yeah.
And I think, it reminds me of a story. My husband was an athlete and he was a marathon runner. And he talked about how the only one he could compete against was himself and not other people. And that meant not comparing himself to other body sizes, to other people's experiences, but that we can only compare ourselves to ourselves and how we progress.
Yeah. Yeah. Good. Thank you for that. Um, I wanted to mention just really quick, uh, the treatment modalities that we typically look at for borderline personality disorder, and show that, typically the cognitive behavioral therapy and dialectical behavioral therapy are the two go-tos. And essentially we're just looking at negative thought patterns and schemas, and then, teaching skills and, changing those thought patterns and incorporating skills training into that, such as the mindfulness and distress tolerance, emotion regulation, and interpersonal effectiveness. And in fact, dialectical behavioral therapy was made for borderline personality disorder. So there are a lot of different things that can come into it. The whole point is that I want people to know that you can heal from it. The problem is most people don't maintain. It's a lot of hard work, and you have to really want to get better. But I just want to tell you guys that if you are suffering from borderline personality disorder, there is hope. It's going to be painful, and you're going to have to put a lot of work into it, but there's hope. You can heal. I've seen it happen, but it is not easy. So anyhow, I wanted to thank you, Caroline, for joining me on this video to discuss this. Um, I really appreciate your expertise. And uh, going forward this month, we're going to talk more about borderline personality disorder and help the individual out a little bit more next week, and then talk about relationships, and also talk about what you can do if you're in a relationship with someone who has borderline personality disorder. So I thank you all for being here and for watching our video, and I hope you have a wonderful, amazing day. And please don't forget to like and subscribe to our channel, and we will see you again soon.